Intro. Hey, welcome back to Vetiverse, your veterinary learning space. Today we're talking about one of the most contagious and economically important livestock diseases, foot and mouth disease, also known as FMD. This viral disease affects cattle, buffalo, sheep, goats, and pigs, causing fever, lameness, and painful blisters in the mouth, feet, and teats. If not controlled properly, it spreads rapidly and causes massive losses in milk, meat, and trade. Let's understand everything about this disease, from cause to prevention. Etiology. Foot and mouth disease is caused by the foot and mouth disease virus, FMDV, which belongs to the Picornaviridae family, genus Aphthovirus. It's a small RNA virus with 7 main serotypes: OAC, SAT1, SAT2, SAT3, and Asia1. Each serotype is different, and immunity from one does not protect against another. This virus is very resistant in the environment and can survive for several days in soil, feed, and contaminated fomites, especially in cool and moist conditions. Distribution FMD is found worldwide, but it is endemic in Asia, Africa, the Middle East, and parts of South America. Countries like the USA, Australia, and many in Europe are FMD-free, thanks to strict vaccination and import control programs. In Pakistan and neighboring regions, FMD outbreaks are common in cattle and buffalo, especially during winter and spring seasons when animals are crowded and movement increases. Transmission FMD spreads extremely fast and by multiple routes. The main source is direct contact with infected animals through saliva, nasal secretions, vesicle fluid, milk, and urine. It can also spread indirectly through contaminated feed, water, vehicles, farm equipment, or even the hands and clothes of farm workers. The virus can also travel airborne for several kilometers under cool and humid conditions. Because of this, even a single infected animal can infect an entire herd within days. Pathogenesis. After entering the body, usually through inhalation, ingestion, or wounds, the virus multiplies in lymph nodes and epithelial tissues. Within a few days, it spreads through the bloodstream, a process called viremia. It then targets epithelial surfaces in the mouth, feet, and teats, forming vesicles or blisters filled with virus. When these vesicles rupture, the animal experiences severe pain, drooling, and lameness. During this phase, the animal sheds a large amount of virus, contaminating the environment and infecting others. Clinical signs: FMD affects different species, but the general signs include high fever and depression at the start of the disease, excessive salivation and drooling. The mouth appears wet and stringy, vesicles and ulcers on the tongue, lips, gums, and dental pad. Lesions on the feet, especially in the interdigital space and coronary band, causing lameness. Teat lesions in lactating animals leading to reduced milk yield. Animals refuse to eat due to mouth pain and often become weak and dehydrated. In sheep and goats, signs are usually milder, but lameness is common. In young animals, the virus can attack the heart, leading to sudden death from myocarditis. Diagnosis. Diagnosis is usually based on clinical signs and history of rapid spread in the herd. However, laboratory confirmation is essential. Common diagnostic methods include virus isolation from vesicular fluid or epithelial tissue, RT-PCR, to detect viral RNA, ELISA, to identify virus antigens or antibodies in serum samples. Early confirmation is critical to prevent further spread and losses. Differential diagnosis FMD can resemble other vesicular diseases, so it's important to differentiate it from vesicular stomatitis, blue tongue, especially in sheep, mucosal disease in cattle foot rot, or traumatic injuries on the hooves. Accurate diagnosis depends on both clinical examination and lab testing. Treatment. There is no specific antiviral treatment for foot and mouth disease. Management is mainly supportive to reduce pain and prevent secondary bacterial infections. Treatment measures include providing soft feed and clean water, antipyretics and anti-inflammatory drugs to reduce fever and pain, topical antiseptics like potassium permanganate or mild iodine solution on mouth and foot lesions, antibiotics to prevent secondary infections. Isolation of affected animals until complete recovery. Most animals recover within 2 to 3 weeks if well cared for, but production losses may last longer. Prevention and control. Prevention is the key to controlling FMD. The most effective measure is vaccination. Use serotype-specific FMD vaccines available in your region. For example, serotype O, A, and Asia 1 in Pakistan. Vaccinate cattle and buffalo twice a year and ensure booster doses for calves after 6 months of age. Maintain strict biosecurity. Isolate new or sick animals before mixing with the herd. Disinfect equipment, footwear, and vehicles entering the farm.